Hi everybody, my name is Missy, and I've never done a video blog before. I have done a written one, but not a video one. I've watched many videos on YouTube that were made by people who are chronically ill with things such as Ehlers-Danlos syndrome, postural orthostatic tachycardia syndrome, also known as POTS, or dysautonomia, gastroparesis, IBS, PTSD, all kinds. A lot of those conditions do contain pain as one of the symptoms. And for those that have a combination of different diagnoses, they could have pain just about everywhere, like fibromyalgia. The person hurts all over. Same with RSD for reflex sympathetic dystrophy or something like that. Also causes pain. For many people it starts with an injury of some sort, and it can be a very mild injury so that the patient doesn't even realize what started it, but then their body's nervous system goes into overdrive and they have constant pain. It's a progressive disorder in that it may start in, say, your left foot after you sprain an ankle, and for many people it then spreads up the leg to the other leg, the torso, arms, until it's everywhere. And they describe that pain as literally feeling like you're on fire because all your nerves are just burning. I do have chronic pain, but mine is not a result of some kind of an invisible illness. What is wrong with me is also fairly invisible. You couldn't tell about my condition just by looking at me. I'm going to start out by giving the history that resulted in my current condition. It may take more than one video. I understand YouTube has a 15-minute time limit until you've reached a certain number of views or subscribers. I'm not sure which. Anyway, I started out... I'm 43 years old now. Round about the age of 13, I started having occasional low back pain. My mother took me to see the doctor, and he said that one of my legs was shorter than the other, so they put lifts in my shoes. The problem with that was it wasn't true. So I'm wearing these shoes that make my pelvis, instead of being even, makes one leg longer than the other, so the pelvis did this. That causes a small curvature in the lumbar spine, which creates a weakness. Back then, though, the pain was not constant. It would come and go. Some days it would just ache. Other days I couldn't walk. I gave birth to my first child at the age of 19. And I know you can't tell by looking at me now because I've put on quite a bit of weight that I'm trying to lose, but not doing very well at it yet. Anyway, I have a very small bone structure, so my pelvis is rather small. My firstborn was 9 pounds, 10 ounces. Unlike most babies, she did not have two soft spots on her head. Most babies have a large one right up here and a smaller one in the back of their head. They're also called fontanelles. She only had one, the one on the top of her head, and it was only about the size of my pinky finger, the pad on my pinky finger. So her head did not squish. Because her head didn't give, the only choice was for my pelvis to give, and that's exactly what it did. Your pelvis has 3 joints in it. In the front, near the pubic bone, there's a joint. I forget what it's called. In the back, on either side of your sacrum, there are two joints called the sacroiliac joints. They're made to separate a little bit, not a lot, just a little bit, to aid in birthing a baby. Mine separated quite a lot, about a quarter of an inch to a half an inch, and that's way too big. So after that, my pain became more regular, but I still continued to work. At the age of 23, I was working as a pharmacy technician in Children's Hospital in Boston. I loved my job. I applied for and was accepted to the Massachusetts College of Pharmacy. I wanted to become a pharmacist. 3 months before school started in 1992, I blew a disc. I went to see my primary care physician, who decided that I was making it up. He said I was making it up, that I couldn't possibly be in that kind of pain. He would not order any diagnostic tests, not an X-ray, not a CAT scan, not an MRI, none of it, despite the fact that I had every symptom of a herniated or ruptured disc. Instead, he sent me to an orthopedic surgeon for physical therapy. The orthopedic surgeon also did not believe that there was something wrong with my back, and he forced me to exercise in this machine that isolates your lower back. As a result, that herniated disc ruptured. It then herniated again just in front of the rupture, so it wasn't visible on a CAT scan. After the rupture in the machine, I know when it happened because I was in the machine doing the exercise, and I felt something pop, and this horrendous pain just shot through my entire lower back and down both legs. I went back to my primary care physician. He decided that he was finally going to let them do a test. He ordered an EMG, that's a nerve conduction study. Luckily for me, this was given by a neurologist. I gave him all my symptoms, I told him what was going on, and he told me that I have a herniated disc, that I have to. It's the only thing that fits those symptoms. And he wanted to know why I hadn't had a CAT scan or an MRI, and I told him. Well, he did the nerve conduction test, where basically they stick a needle in and they zap your nerve and time how quickly it takes your muscles to react. Basically, your reflex. My left leg, from my lower back all the way down to my foot, was off by anywhere from a half a second to 2 to 3 seconds to get my muscles to react. My right leg was fine. The doctor, the neurologist, was very angry. He called and got me an appointment for the MRI. He then called my primary care physician, and I have never heard a doctor curse out another doctor, but this guy did. He was swearing, and he was mad, and oh, it was funny. And I was grateful because finally somebody believed me. It's so hard when you've got pain and you're young. The doctors dismiss you. They think you're lying. Add to that the fact that you're a woman. And I don't know if it's like this in other countries, but many doctors in the United States don't treat women with the same respect as they do a man. My primary care physician said it was my period, said it was depression, said I was making it up, said it was psychosomatic, said anything he could think of to dismiss the symptoms I had, including loss of bladder function and loss of sensation for my bowel. Anyway, the neurologist was mad. They did the MRI. It showed a herniated disc infringing upon the sciatic nerve root at L4-5. It also showed that I had extra bones. Apparently my L5 vertebrae tried to become part of my sacrum. So it grew the extra bones, but stopped there, leaving me with, they kind of look like wings off of the L5 vertebrae, and they come down and they rub up against the top of my ilium, which is the pelvis in the back. And arthritis had already set in there, so that was part of the problem. It also showed the separation of my SI joints. By this point, I'd been out of work for 9 months, so I got referred to a neurosurgeon, and since I'd already done physical therapy 3 separate times with 3 different physical therapy providers, we opted for surgery called a laminectomy. They go in and they shave off the bulging disc. Well, when they went in and they shaved it off, that's when they found the rupture. It had ruptured so strongly that literally pieces of the disc material were embedded in the sciatic nerve root. One of them had chipped off the side of the nerve root and was in my abdomen. They had to go get it. As a result, I had a lot of nerve damage, and it made it impossible for me to stand on my feet for more than 15 minutes. I could no longer sit in a single position for more than 15 minutes. And the doctor, I was 24 now, and the doctor looked me in the face and said, "That's it. I'm permanently disabled." That devastated me. It really did. I loved my job. I loved it. It was hard, especially when the patients died, but it was wonderful. I saw some horrible things, and I saw things that could only be a miracle, and I just loved it so much, and now I can't work. I was raised to believe that I should stand on my own 2 feet, work hard. Hold on. Work hard, support myself, not to rely on other people, to be independent. And now here I am at the age of 24, with a 5-year-old child relying on me, disabled and unable to work. It was really hard. Now, as a result, I did have permanent pain every day. The only difference was how strong the pain was. Luckily for me, at that time, and for a few more years, it was not very intense. On a scale of 1 to 10, and I will give you my pain scale in another video, but going by my pain scale, which I personalized to myself, ooh, excuse me, I was at about a 2, and on a bad day it was like a 5, maybe a 6, unless it was a really bad day and my leg just would not work. I could no longer drive a standard shift car because my left leg specifically, would just stop working. I couldn't even wiggle my toes if I wanted to. Alright, this is at 13 minutes, so I'm going to go ahead and stop this now and pick up with video number 2. I'll see you in a minute. Bye, everyone.